Welcome back, everyone. May is Preeclampsia Awareness Month, and that's a serious pregnancy condition that can put both mothers and babies at risk. Dr. Jessica Cantu is a maternal fetal medicine specialist at St. David's Women's Center of Texas. She's here to talk to us about the warning signs, who might be at risk, and why early detection can make all the difference. And Dr. Cantu, thank you so much for joining us.
Of course. Thank you for having me.
Well, first, I know a lot of people don't even really know what preeclampsia is, but so many women can actually be threatened by it. Tell us more about it.
So preeclampsia affects about 5 to 8% of all pregnancies. And many people have heard the term preeclampsia, but don't really understand what that means. And it's a high blood pressure condition specific to pregnancy that can develop in the second half of pregnancy or even after pregnancy for up to 6 weeks, and can lead to life-threatening complications for both mom and baby.
So how does a woman know that she's at risk for this, or can it really strike almost any pregnant woman?
So it can strike any pregnant woman, but there are definite risk factors that increase the likelihood of that developing. So if you've had a prior pregnancy affected by preeclampsia, if you have certain medical conditions like high blood pressure before pregnancy, kidney issues, diabetes, any kind of a lupus or autoimmune disorders, those risk factors can significantly increase that chance. But it can happen in even young, healthy mothers, and so everybody needs to be aware of the signs and symptoms to look out for the condition.
And that's what I was going to ask. Are there specific groups who are more prone to preeclampsia than others?
Yes, so those that I listed with that are the highest risk, but other risk factors that also increase. So first-time moms and young or extreme of age, so young or older women, women who have a family history and a mom or a sister, Black women, women who've had other IVF or obesity are all risk factors. So there's a number, about 17 risk factors that can lead to a higher chance of preeclampsia. And in those women, we offer what's called low-dose aspirin to try to reduce the risk of developing preeclampsia.
Now, what kind of difference can early preeclampsia monitoring make in a woman's pregnancy?
So preeclampsia can be very unpredictable, and it can range from very mild symptoms to very severe, life-threatening conditions that often come on very suddenly, even between a week of a prenatal visit. So there are certain symptoms that we should counsel every pregnant woman: a headache that's different or severe, vision changes or differences in your vision, pain, especially up in this upper part of your belly, or problems breathing. Those can all be very normal symptoms in pregnancy, but they should not be ignored because it's sometimes the only sign that preeclampsia may be developing.
I was going to say, and I know that this can affect the women, but what about the babies? What can this mean for them?
Yes, so the babies have significant risk. Over 500,000 babies a year die because of preeclampsia complications. It can affect the placenta, so babies often can grow small. They can have an intrauterine death, and the biggest risk is having to be born premature and the associated complications associated with that.
Well, what are some ways that a woman's birth partner can advocate for them and their health during pregnancy?
Just being aware of those signs and symptoms, and so that if something's off, if she's not feeling right or not acting right, to encourage her to not just attribute it to normal pregnancy symptoms, and to seek care and to notify their OB provider.
Because that's what a lot of women do. They're like, oh, I'm just pregnant,
Exactly.
It's fine.
Yes, and it's very common.
Well, Dr. Cantu, thank you so much for being with us, and thank you so much for all of the great information. I know a lot of women out there are definitely listening and taking this to heart.
Thank you so much for having me.